Yeah, so this was a post-hoc analysis of the ELEVATE-RR study. So that was the head-to-head trial of acalabrutinib versus ibrutinib in high-risk relapsed refractory CLL. And so, we see with continuous treatment with really any agent, you're going to have a lot of toxicities that come up over time, and it's really hard, if you're assessing somebody for 5 years, each time somebody reports back pain, it is going to be counted. But, side effects that are very frequent, like back pain, tend to be higher than what is actually reflective of the drug itself, just because these common toxicities will occur in people if you watch them over 5 years or so. So what we used was a novel method of assessing toxicity burden, taking into account both the incidence, severity, and the length of time a person experienced an adverse event. And we thought this would be a good way to measure actually the burden of a toxicity on an individual patient. We had previously done an analysis like this with the Alliance AO41202 study. So that was ibrutinib rituximab versus bendamustine plus rituximab. And here, again, we were trying to compare two continuous BTK inhibitors. So we saw, as you might expect, that the adverse event burden was higher with ibrutinib compared to acalabrutinib overall. A number of the side effects that, again, you might expect. So cardiovascular burden was higher with ibrutinib, atrial fibrillation, hypertension. Musculoskeletal adverse effects were higher in ibrutinib than acalabrutinib. Things like diarrhea and headache were both higher in acalabrutinib treated patients. So overall, I think that this is just showing us that novel ways of assessing toxicity are important, and that a design like this may be useful in future studies too.